Good. All right, everybody, welcome. Let me know in the Q&A on Zoom and in the chats on Facebook, YouTube, and TikTok if you are hearing me okay. Let me know if everything is coming through. You guys hear audio, you see me okay? All right, awesome. It looks like things are working. So let's go ahead and let's get started. So for those of you who haven't met me, my name is Rachel Taylor. I have been in education now for just about 4 years, but with Archer Review for 2 years. And I absolutely love it. I love helping students who didn't think they were going to be successful taking the NCLEX exam find that success. So today, over the next 30 minutes, we are going to test your nursing knowledge over health promotion and maintenance, one of those awesome areas of the NCLEX test plan. So I just briefly want to talk about this category and then we'll go ahead and get started. So when we talk about health promotion and maintenance, they're really focusing on a few specific things here, like hygiene and personal care, being able to bathe the client, make sure you do proper oral care. Then we've got mobility and immobility, and that's assessing clients with mobility issues, with ambulation, what complications may happen if they're immobile for a long time. Then we've got all of our nutrition and oral hydration, elimination, our comfort measures, rest and sleep, assistive devices, and complementary therapies. So the NCLEX can present several different scenarios over these topics. And what they're really doing is they're having you apply your critical thinking skills and your nursing knowledge to ensure that you can provide safe and effective care. So we're going to go ahead and actually get started. You guys are going to join me on slido.com. So you can just type in slido.com into your phone or a web browser and type in rapid 30 to join our Slido poll. We're utilizing it a lot for the next 30 minutes. So please join me on Slido and we will go ahead and get started. Again, go to slido.com and type in rapid 30. All right, we've got individuals from Canada, Mississippi, Arizona, Toronto, the Philippines, New York, Iowa, awesome, Indiana, lots from New York and California, amazing, Chicago, that is great, Florida, New Jersey, Nebraska. All right. It looks like we've got people from all over the country. That is amazing. Dubai. Awesome. Texas. Welcome. Now, if you're joining me on Zoom and you're like, hey, Rachel, the chat's disabled. The chat is how I could communicate with all of you, but you will actually utilize the Q&A feature. The Q&A feature is how you can respond to me if you are joining on Zoom. All right, welcome, Montana, amazing, Kentucky. All right, it looks like most of you have joined, so let's go ahead and let's get started. This is going to be fast paced. I'm just going to tell you that right now. We're going to move pretty fast over the next 30 minutes. So be ready, have your phones up because we're going to utilize a lot of Slido. So our first big category that we're going to go through is growth and development. So how it's going to work is I'm going to give you guys a statement and you're going to answer it in Slido. So this stage of development, according to Eric Erickson, involves developing a sense of trust or mistrust. Ooh, okay. What's our answer here, guys? This stage of development, what is this called? Yes, you guys are getting it. Impressive. Good work. Thank you for joining us on TikTok, on YouTube, and on Facebook. Go ahead and share the stream. If you have any other nurses, future nurses that you know, you're welcome to share the stream with anyone that you would like. Okay, you guys got it. Now you're telling me infancy. What is the age range for infancy? Anyone remember that range? Good. Nice job. That first year of life. So the answer here was, what is infancy? So in this stage, it's when the child is gaining their basic trust. It's kind of their expectation that the needs are going to be met by their caregivers and that the world is a safe place. When we see distrust, it's because the needs of the infant continue to be unmet. And then they form this thought of that the world around them is not a safe environment. All right, guys, on for the second one. Ready? According to Piaget, during the stage of cognitive development, children develop the ability to think logically and understand conversation. Ooh, okay. Now we're in Piaget and cognitive development. If you're anything like me, the growth and development section in nursing school was very challenging for me. It's a little tricky. Look at you guys go. I see several of you getting it correct. Nice work. Amazing job. Someone just joined us on TikTok, CS Walker, and said that they just passed their NCLEX exam yesterday. We are so proud of you. Thanks for letting us know. I'm glad that Archer Review worked for you. That is incredible. Thanks for letting us know that. Congrats. All right, you guys are getting this one. And next step, tell me the age range that this cognitive development level is occurring at. What's the age range here? Another individual just joined us, letting us know they passed the exam today. Congrats, Anna. I'm glad that Archer Review helped you on your journey. Congratulations to you as well. Amazing. 2 people joining us that have passed on TikTok. All right, you guys got it. 7 to 11 is this age group. It's what is concrete operational. So what this involves is mastering the use of logic in concrete ways. So the word concrete refers to what is tangible. It's what can be seen, touched, or experienced directly. So that's what concrete means. You know, I can see my coffee cup. I can feel my coffee cup. That's what the word concrete is referring to. All right, next one. During this stage of development, adolescents struggle to establish their identity and may experience role confusion. Ooh, tricky, tricky. If you're RN, if you're PN, you can join us. This is really meant for anyone prepping for that NCLEX. You're fine to join us. Yes. All right, you guys are getting this one. Amazing. Identity versus role confusion. Now, what's the age range here? What's our age range? Absolutely. You guys got it. Great work. Nice job on this one. All right. So for this one, it was what is identity versus role confusion. So really, when someone is in that adolescent age, they're really trying to determine who they are. And this is affected by several things. Does anyone know what kind of the number one group that affects adolescents? What group is really affecting that age? Anyone know? Peers, right? Their peer group. So a lot of times their peers are determining what their values are. They can change their values based on their peer group. And so we want to really help them understand who they are. And that's the goal in this adolescent stage. All right, here's the next one. This age group often experiences generativity. I did not say that right. Sorry, guys. Versus stagnation, where individuals focus on their careers and family relationships. Ooh, let's see. Let's see if you guys can get this one. Okay, you need to be a little more specific than adulthood. Adulthood, there's several stages of adulthood. There's young adulthood, there's middle adulthood, and then we've got our older late adulthood. Good. So what age range are we talking here? Versus stagnation. Wow. Impressive. You guys are getting it. You're doing great. Somebody asked about our next 3-day live review. Our next 3-day live review is going to be February 7th, 8th, and 9th. It runs from 9 a.m. to 5 p.m. Central. It is included with our SurePass combo. If you are interested in that, that's our live review that would be coming up. All right, guys. Our answer here was, what is middle adulthood? So when we're talking about that generativity, there we go. I said it right that time. It refers to really making a positive impact. It means that we've contributed to the world, right? So in middle adulthood, people are thinking, have I made a difference? Did I contribute? This can happen through raising children, mentoring others, engaging in meaningful work. And then on the other hand, we have that term stagnation. And that represents feeling stuck when they feel unproductive, like they don't have a sense of purpose, right? When someone says midlife crisis, that's what they're talking about, this stagnation period where individuals feel like they just, they maybe just haven't met whatever their sense of purpose is. All right, on to the next one. According to Kubler-Ross, these are the 5 stages of grief. Now, if you don't want to list all 5, try to at least list 1 or 2. All right, several of you are getting this one. Nice work. You haven't joined us on Slido yet, you can do so by going to slido.com and typing in Rapid30, or you can scan that QR code and it will bring you right into our session for today. Awesome. You guys are getting it. Let's take another 10 seconds. Absolutely. Nice work. Now think about this for a second. Do they have to go through those stages in that order? Do they have to go through those stages in that exact order? That's the next thing I want you thinking about. So our answer here is, what are denial, anger, bargaining, depression, and acceptance? Now, I will say people go through these in different orders. When we talk about Kubler-Ross, yes, they're going to hit these all at some time, but maybe they feel anger a little bit before denial. And maybe they go back and they go through these several times. So that's something I want you to consider, is it's not always denial, then anger, then bargaining, then depression, then acceptance. Usually we're ending in acceptance, but maybe they have acceptance and then they don't anymore and they go back through the stages of denial and anger and bargaining. That can happen several times before someone has truly accepted what has happened to them. All right. Our next big topic is health promotion. So we've got kind of a new round of questions, and this one is going to be health promotion. All right, guys, let's see how you do in this category. This type of prevention focuses on promoting health and preventing diseases before they occur. Let's see how we do. Impressive. You guys are doing great. You're getting it. So as you're waiting, as we're letting more people answer this, I want you to think of 1 to 2 examples of what primary prevention would be. And let me know in the chat on TikTok or the chat on Facebook, YouTube, or Zoom. What are a couple examples you can think of that would be included in primary prevention? Good. Yeah, you got it. Absolutely. Somebody said immunizations are vaccines. You got it. Absolutely right. Another big one that falls into this category is education. So when I think about primary prevention, what I'm thinking of is vaccinations and I'm thinking of education. Anything that prevents the disease from ever happening, okay, is primary prevention. So any education before a disease process has occurred, as well as, again, those immunizations. Now, somebody said health fairs. That's not quite primary. You'll see what that is in just a moment. Great examples, everyone. Nice work. Yeah, eating healthy foods. That's a great example. All right, this type of prevention focuses on preventing diseases from getting worse and chronic treatment. Ooh, all right. Let's see how you guys do on this one. You are getting it. So they already have a disease process. It's focusing on making sure that disease doesn't worsen, as well as that chronic treatment, which is going to be tertiary prevention. Tertiary prevention. So they already have the disease process. So an example of tertiary prevention, maybe we have a client who comes into us and they have congestive heart failure. So to ensure their congestive heart failure doesn't worsen, I have to educate them on a few things. And what are some things I might educate them on? A low sodium diet, a fluid restriction, making sure that they take their diuretics, maybe in the morning to early afternoon. Because if they're taking them at night, now they have got an increased fall risk because they'll be peeing all night long and not sleeping, right? That's some education I would give these clients. And that's tertiary prevention. Why? They already have the disease process. Now, if it was primary education, it would be before the congestive heart failure ever occurred. It would be teaching our clients how to make sure they have good blood pressure, they're eating healthy, they're exercising to ensure they don't get hypertension because hypertension is a leading cause of congestive heart failure. So education can technically fall into both. It depends on how that education is given and to whom that education is being given to determine which category it's going to fall under. All right, here's our next one. This vaccine is recommended for infants to protect against potentially serious diseases like diphtheria, tetanus, and pertussis. All right, let's see how you guys do here. Look at you go. You got it. Absolutely. Right. Let's take another 15 seconds on this one. You guys got it. This one is going to be, what is the DTaP vaccine? What is the DTaP vaccine? So we kind of have two that cover these. We have Tdap and DTaP. They're both really helping protect against the same diseases. They're just used for different age groups. So Tdap is recommended for our older kiddos and adults, and then DTaP is recommended for infants and young children. And then DTaP is what we give in pregnancy. So we want to make sure that moms are up to date so that way they can pass some of that immunity to their unborn child. So we also will give that Tdap to mom. All right, here's our next question. What immunization is recommended for children to prevent a contagious viral disease, which, if not protected against, can lead to complications like pneumonia and encephalitis? Ooh, tricky one. This one's really hard. So if you guys don't know it, take a guess. It's really hard. Impressive. Some of you guys are getting it. Great work. You have not yet joined on Slido, you can join by going to slido.com and typing in rapid 30. Impressive. All right, our answer here is what is MMR? So measles, mumps, and rubella vaccine. If our client were to get this disease or these diseases, right, they can lead to further complications. They can end up with that encephalitis. They can end up with pneumonia. All right, here's our next one. This screening test is recommended for women over the age of 40 to detect breast cancer. And with this, tell me what type of screening this is. Is this primary, secondary, or tertiary? What type of prevention is this? Primary, secondary, or tertiary? Good. Ooh, tricky. Lots of people are saying secondary though, but primary is right behind it. What's the winner here? Hey, our answer is what is a mammogram? And with that, the answer to that was screenings are secondary prevention. I always remember S&S. Screenings are secondary prevention. Health fairs would fall under that. Any type of health fair where they're checking height, weight, blood pressure, all of those things would be included in secondary prevention. What the goal of secondary prevention is that we identify a disease process or a complication early. Why? Because if we can identify these things early, the chance of survival and a good outcomes goes up dramatically. Now, if you are like, Rachel, this is a little complicated. I don't understand health promotion and maintenance very well, or I just need a little extra help, a little boost before my NCLEX exam, I would consider private tutoring. Our private tutors have been hand selected to work for Archer Review. They are all incredible. They're amazing. Private tutoring is $75 per hour. And really, the goal of it is to focus on whatever you need the most. Maybe that's determining, hey, am I ready to take the NCLEX exam? Maybe it's walking through some medications or the cardiac system. Honestly, whatever you need, these tutors are fit for the job. We've got Allie. She does a lot of OB maternity as well as helping with test anxiety. Emma is and Kate are both into cardiac and pharmacology. Lauren is also pharmacology and is our night tutor. So she's amazing if you need somebody in the evenings. Then we've got Jennifer. She's kind of does a little bit of everything, but really focuses on testing strategies along with Megan. And then we've got Elizabeth, who focuses on the areas of the NCLEX test plan. All right, we've got another individual on TikTok, Kayleen, who said, hey, I passed my NCLEX on Tuesday. Congrats to you, Kayleen. Thanks for letting us know. Amazing, amazing. All right, our next category is nutrition and diet. This will be the last category that we get through today. So this is the body's main source of energy. What is the body's main source of energy? I know nutrition was a while ago. You usually take it before you're even in the nursing program, but we want to get this information kind of back up into the front of your brain because you can get tested on nutrition for the NCLEX. So let's do a little dive into diet and nutrition. Oh, you guys got this. So the main source of energy is what are carbohydrates? What are carbohydrates? We try to burn those carbs first. And then if we don't have that, then we can go to other sources. All right. These are essential nutrients that provide energy, support cell growth, and repair tissues. Let's see how we do on this one. If you're unsure if tutoring is for you, you can email us nclextutors@archerreview.com. We would gladly chat with you and help you determine if we think you need a tutor or maybe you don't need a tutor, and we can give you that suggestion via email as well. You can just email us at nclextutors@archerreview.com. We'd be happy to respond to you there. All right, you guys got it. Protein, absolutely. What are proteins? Proteins are really important when it comes to repairing that tissue. Absolutely. Nice work. All right, our next one. This fat is considered the bad fat and is associated with an increased risk of heart disease. This is why we kind of educate clients not to consume a lot of it. You guys are telling me cholesterol. You're telling me the bad type of cholesterol. I want the bad type of fat. You would be able to read this on like a label, right? If I were consuming a food, I could look at this label and I could see this ingredient. There we go. There we go. Nice job. You guys are getting it now. Perfect. Absolutely. Absolutely. When I'm talking about fats, I'm talking about what is saturated fat. LDL would be our lousy, our bad cholesterol. But when I'm talking specifically with the word fat, I'm talking about saturated fats. So, what we teach our clients to lower their risk of having heart disease is to eat a low fat diet. And that really includes making sure their saturated fats are low because saturated fats increase the risk of that heart disease. Okay, this mineral is important for bone health and nerve function and is commonly found in dairy products. Ooh, let's see. You guys are getting it. Absolutely. Nice job. The answer here was what is calcium? What is calcium? All right, here's our next one. These vitamins are water soluble, hint, hint, and are important for maintaining healthy skin, mucous membranes, and vision. Okay, so fat soluble vitamins would be A, D, E, K. When we talk about water soluble, our water soluble vitamins are going to be those B vitamins. So our answer here is what are those B vitamins? What are those B vitamins? Now, if you're like, hey, private tutoring is too expensive, it is not in the budget, we offer a second option for you guys. It is small group tutoring. So here we do 2-hour NCLEX reviews, mock NCLEX exams, EKGs, pharmacology basics, comprehensive pharm reviews, L&D reviews. There's kind of a little bit of everything here, but the cost is much lower. The cost here is $25 per hour session, and it's limited to 15 students per session. So you're still getting the personalization. You're still getting all of that. The difference here is there's going to be a set topic, whereas private tutoring, that one-on-one tutoring, you get to determine, okay, you get to determine if you, what you want to go over, what you want to talk about. Where with small group tutoring, there will be a set topic and there will be potentially up to 14 other students joining you there. All right, guys, that brings me to the end of our session today. Are there any quick questions that I can answer? Whether you're joining on Facebook, YouTube, Zoom, or TikTok, are there any questions that I can answer for you? Hey, let's see. When it says that you get to interact with instructors for the SurePass package, it indicates that when we are teaching during our 3-day live review, you get to ask us questions. We answer your questions live a lot of the time if they're pertinent to the entire group. That's really what we mean by interacting with our instructors during that live review, that 3-day live review package. The vitamins for the last one were our B vitamins are water soluble. Fat soluble vitamins are A, D, E, and K. Okay. What other questions do we have here? Okay, somebody asked, what is the difference between SurePass and Intense Prep? I'm trying to buy a package and want to know which one will be better. If you're a repeat task taker, Intense Prep is the package for you. Intense Prep is 6 weeks, very intense. You've got Mondays are feedback sessions from one of our tutors, and then Wednesdays are small group sessions with those tutors. Tuesdays, Thursdays are live lectures. And then Monday, Wednesday, Fridays are live case studies that you get access to. You get a 6-week, very detailed plan with Intense Prep. Our SurePass combo includes our QBank. It includes our on-demand videos, which Intense Prep does as well. And then you get access to our 3-day live review. The next one is going to be February 7th, 8th, and 9th. It is a 24-hour review. It's 8 hours each day. And with that, we're really going over all the high-yield NCLEX content in those 3 days. If you do miss part of that live review, as long as you have purchased the SurePass package, you do get access to that recording. Absolutely, you do get access to that recording. All right, I believe I answered all of those questions. Let me make sure there's no other questions coming through. All right. You're right. C is also a water-soluble vitamin. You got it. Good job. Okay, someone asked about pedal edema. What's the difference between +1, +2, +3? It's the depth that you're able to indent into the skin, plus the duration of time that it stays indented, right? If I push down and it comes right back up, well, that's not really pitting very bad. So the +1, the +2 is determining if it's pitting edema. When we have pitting edema, that's when we would rank it +1, +2, +3, +4, based on the depth and the duration of time that it stays pitting. That's what it's asking about. All right. I've got Darlene who just let us know that they passed their exam as well. Congrats. That's amazing. All right. Awesome. Amazing. Thank you guys so much for joining us. I think I got all of these questions answered. But if you need anything else, email us here at nclextutors@archerreview.com. We'd be happy to assist you there. Good luck on your NCLEX exam. We're rooting for all of you. And thank you for being a part of the Archer Review family. Bye, everybody. I hope you have a great day.